Okay, lifespan. This is just a talk about a lot of things and over the lifespan of your life in a very, very short time. How's that sound? Okay, big thing we want to talk about is the different physiological and characteristics that change throughout the aging process. And I mean, a lot of times if you realize we're always talking about, the 70 kilogram, 5 foot 5 male that we always base everything off of. Well, the thing about this is that there obviously are going to be variances, and throughout our ages and depending on what our disease processes are or development, every year you're going to see a lot of little tweaks here and there. So it's a good idea to get familiar with the different tweaks and how things change. Therefore, when you sit there and say, yeah, this pediatric only has a blood pressure of about 84 over 84 systolic, that's okay. Little kid could have that. The age groups here, obviously we got neonate, 1 to birth, infant, toddler, preschool here, adolescence, and then adulthood. As you can see, it's broken up into 3 stages here: early, middle, and late adulthood. Neonates and infants. One thing, if you kind of notice, the smaller you are, the higher your heart rate is, the lower your blood pressure, and the higher your respiration is. And actually, you'll notice that with animals too. So if any of you guys got dogs or cats, I'm sure if you go actually listen to their heart rate, it'd actually be a little bit higher than what we'd consider normal. However, like an elephant's normal heart rate is probably sitting in the 50s. Kind of like I said, it's just interesting how the smaller you are, faster it is, and then as you get bigger, those values start to change there.
Stroke volume, I guess?
All the organs are going to be maybe got smaller lungs, so they're going to be faster.
Yeah. Well, the thing with neonates and infants, they have more of a physiological demand of about 500 that would meet 500 cc's of blood, but they only have about 300. So they got to compensate for that. And you got to remember, especially with a neonate, they've been relying on maternal circulation for so long. Now their body's got to start kicking and going and keeping up with it. Cardiac output is heart rate dependent. Like I said, with the neonates and the small children, they haven't had time for the muscles to grow and develop. So, obviously, as we get older, the muscles get bigger. We get more stroke volume in the long run. But for kids, they don't get that. So when we start seeing a lot of elevated heart rates with children, like I said, that's them trying to compensate right away.
Can neonates go into VFib easier than an adult, since their heart rates are already high enough?
Actually, it's the opposite. A lot of times, you got to remember, a lot of times the VFibs, VTACs usually result from atherosclerosis. But when you see a cardiac arrest with children, it usually comes down to an airway issue. Mm-hmm. They're not getting oxygenation from someplace. But if you actually do see VFib, VTAC in a child, that's very, very bad. I mean, that's something congenital, something else.
Disease or something going on.
Yeah, they just normally don't do it. It could be you could go through a lot of things, but usually, even with a lot of the congenital diseases, I mean, they'll actually, like I said, get more of that hypoxia, will cause it more of that tachycardia, then down to bradycardia, and then usually asystole, or what they call PEA, pulseless electrical activity. Again, like you're seeing the monitor going beat, 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 but there's nothing going on here, no palpable pulses. So tidal volume here, we're looking at 6 to 8 mLs per kilogram, doubles in the first year because we're growing. So weight, 3 to 3.5 at birth, slightly lower up the first week, then doubled by the 6th month. What's also going on within the first couple months of birth? And he said we're talking about maternal circulation and all that changing.
Immune system?
What about the immune system?
Firstborn, it's not really grown. I mean, it's just very weak.
Huh? Yeah, so what's it relying on? Yeah, mother. A lot of mother's antibodies are transferred into the child, from, milk and also from, circulation as well. They talk about, all of a sudden they say children getting a little jaundice, because that's all maternal circulation. That's all those blood cells are being broken down. You get that increased bilirubin, and that increased bilirubin gives you that color, and then it gets cycled out.
That's why they put them under that blue light.
Mm-hmm. So at that point, like I said, we're actually waiting for like I said, the grown catch up. That's, a couple things here when we talk about physiological differences is, you guys familiar with ductus arteriosus? Okay, we're going to talk about ductus arteriosus, ductus venosus, and formavoli. These two up here actually turn into ligaments as you get older, just to let you know.
Is one of those like the one that sits on top of like the pulmonary vein or something? That, what is it? Or is that I don't know what it is. It's like the pathway that goes to your heart because your lungs aren't circulating. Because you
Are you
can't
talking
breathe.
about the septum thing that has a hole in the
Yeah,
septum?
whatever
Where it
that's called.
bypasses from the blood circulating along like
Yeah,
one in
because
the
your
womb.
lungs can't function. So
We're going to get to that in a minute. Yeah, there's actually a couple bypasses, but so again, big thing here is actually, which we were just talking about that. It actually goes straight into from pulmonary artery to aorta. Right, the whole system here is actually designed to bypass the lungs in utero. That's all. So, which is kind of interesting because maternal circulation, it's actually from mom is actually coming in through the umbilicus up through the inferior vena cava, and then it comes to the right ventricle, and then, like I said, we're actually trying to bypass going to the pulmonary arteries to go straight back down to the aorta. We don't have functioning lungs at the time.
So that's how babies don't drown in the aqueous environment of the embryonic sac?
Yeah, pretty much. They're not breathing. There's nothing stimulating them to breathe either. The fluid's there. It's just not doing anything. So the thing is, when you get also the other thing here, the formavoli goes from the right atrium to left atrium. There's basically a little flap there, and this pushes and pushes. And what happens actually is when you come out and you get stimulated, take a deep breath, that endothoracic pressure, usually that fluid gets pushed down. And actually, ductus will actually close up probably within a week at the latest. But the formavoli, because of the pressures, gets slapped shut. And then it actually just becomes just another landmark. I can't think of the actual landmark. It actually becomes. The congenital defects is like when some of these things stay open. That's the problem that lies there. But your umbilical vein actually becomes ligamentum teres, which sits under your liver. This becomes, when ductus arteriosus close up, it actually becomes ligamentum arteriosus. That's one of those things when you talk about like traumatic injuries and they rupture their aorta from a car accident, it actually it basically pulls open that artery right there because it's a ligament now. That shearing force there. With the liver, like I said, becomes ligamentum teres, a good traumatic force that can actually sever the liver going up this way. So it's kind of interesting how the body just kind of took use of what was there and redid it, but it can also be used to our detriment too. But again, like I said, a lot of these ligaments and stuff, they're actually holding, structures in place. But like I said, too much force is detrimental. But yeah, the circulation, as you can see, is actually relatively backwards because like I said, we're bypassing the lungs. So oxygenated blood is actually coming in through the venous system. Let's see there. Into the venous system, and then, like I said, bypasses the lung, circulates, goes right back out, and unoxygenated is actually coming out through the arteries of the actual infants or embryo. Was it fetus's arteries? You guys kind of with me on that?
So whenever the umbilical cord gets cut, it's feeding, getting the blood and everything goes to the heart. What happens to that? What happens to it? When the umbilical cord leads up and then it gets the flow to the heart right there, what happens to that?
That becomes ligamentum teres. That's ligamentum teres.
Okay.
Yeah.
How long does it take? Is that like a long...
Usually within a week or so. That one's not the big one. That's not the one we ever really worry about. This one will collapse relatively quick. The one actually that we end up have problems with is ductus arteriosus and the formavoli, is because it starts bypassing. It starts bypassing, and obviously you don't get oxygenated cells, and you see the whole polycythemia issue, and like I said, the babies start turning blue and all this other business. And the same thing with this one. If this doesn't close, again, a deoxygenated blood just gets bypassed right back into the system. So we don't get, baby's not getting fully oxygenated at that point.
The one that closes is called the
Fossa?
It's O-V-A-L-I-S.
Ovalis? Fossa ovalis? Yeah. But That's really what, like I said, really, that's fetal circulation. When you guys actually, they used to actually teach when, years and years ago in PALS, Pediatric Advanced Life Support, when baby was born, what ways we could get around having to give any kind of circulation, we would actually use the umbilical cord.
You just hook up to, or for injecting stuff?
Yeah, I mean, we would literally, because they always want so much space afterwards because in case we needed to put PICC lines or something like that. But the way they taught us is like, you make sure you have at least an inch, because if you go further, you can go in and lacerate the liver, which we don't want to do. But we would actually just get a catheter and already hook. Hi, can I help you? All the way to the end, make a left, follow it down, and you'll see some classrooms off to your left again. But we'd actually have a catheter hooked up, obviously without the needle, and we'd just tuck it in there and then cinch it around, and that would be our IV. I mean, it was already open, so. I think they teach that in what they call neonatal resuscitation protocol, NRP, but they took it out of PALS years ago. Understand pulmonary system, it's short and narrow, easily obstructed. I think we kind of talked about that quite a bit in airway. Remember, babies are nose breathers. They're always nose breathers. And where do we suction first after delivery? No. Yeah, remember that. Flexible chest. Understand, actually the skeletal system is actually very flexible. It's a lot of cartilage. And as you get older and the baby you start to develop, it actually becomes the osteocytes. But like I said, that's why have you guys ever heard of like bend fractures or anything like that? Not green stick, bends. They'll actually bend. It isn't actually a fracture, but the problem is the cartilage, I mean, even like up to 3 years old, is still soft enough force, it'll actually bend up.
Right?
Yeah.
How do they fix it? I mean, what are they?
I don't know if they go back the same way. They snow them out and try to push it back down the same way. But that's just kind of one of the things. The other thing I was telling you about the chest wall, just remember like how our ribs are kind of doing the slant. Theirs are straight across, so we don't have that, expansion. You see them breathe through their belly a lot at that point. So obviously immature accessory muscles, diaphragmatic breathing, and high ventilation leads to rapid and fluid loss. One thing you remember with children is they don't have the oxygen reserves that we do. Okay, one of it is because of obviously we have more red blood cells and more hemoglobin, but we also have myoglobin as well, and that's in our muscles, and that also can hold oxygen. They also don't have the sugar or calcium stores. So just, whenever I've done like third semester to talk about pediatric, it's like I can sum this whole lecture up in 4 things. Check their airway, check their heart rate, check their sugar, check their temperature. You cover those bases, you'll probably be fine. But that's just, again, things to kind of look out too. Like I said, the rapid fluid loss, rapid heat loss. Understand they don't have developed muscles to shiver yet. They don't have the neural pathways developed enough to shiver. So, and airway considerations with this kid?
His neck is hypersplenic.
That's actually kind of normal for him, though. I mean, if you had to ventilate or manage this kid's airway, what would you do?
Something under his shoulder.
Yeah, put something right kind of behind his shoulder.
What kind of problems are you going to run into?
Obstructions, like
I mean, airway obstructions, smaller.
Small. Very, very small. Yeah. Hmm?
Just smaller.
Yeah, you just got to be a little more delicate, a little bit more finesse on that. But it's just, like I said, children are a little bit easier. It's just, I think a lot of times just getting over that thing of I'm sticking a tube in a child or having to do this kind of procedure with a child, but it's just small, less workspace. Renal system, able to concentrate urine at that point. Then we talked about immune system being passive for the 6 months. And then after that, like I said, acquired immunity until after 6 months at that point. And the thing is, if you kind of notice that, obviously kids get really sick within the first year of life, and so because they're exposed to everything, they're getting exposed. We're getting exposed to things all the time. We just bounce it off. They're brand new. Musculoskeletal, mostly reflex movement. We'll talk about the reflexes here, but we should have equal movement in all the extremities. The different reflexes, probably be familiar with these in the fontanelles as well. The Moro reflex is basically if you start with a child, it kind of goes up and then will actually try to hug. They think a lot of these reflexes stem from years and years ago of this basically some kind of survival. For example, like the palm, where you stimulate the palm, it grabs, it holds tight kind of a thing. Or the rooting reflex, basically you touch their cheek, they're looking to, suck on something. And obviously, suckling stimulation at the roof of the mouth too. So, but like I said, they kind of theorize why we have those. I mean, why exactly, who knows, but I think they're just something that just passed on from, I don't know, early caveman times per se. Fontanelles, again, posterior closes about 3 months. The anterior, we're looking at 9 to 18. If you guys aren't familiar with children, especially when you get around babies, get your hands on them so you can feel what a normal fontanelle feels like, because you don't want to mistake a normal fontanelle for a bulging fontanelle, because it does kind of bulge just a little bit, but it's not bad. So I mean, just get your hands and kind of get that feel for it. And what does bulging fontanelle mean?
Increasing intracranial pressure.
Okay, and the second one?
Dehydration.
Yeah. So generally, we're looking at sleep at 18 hours a day. Is that true?
Yeah.
Yeah, it's in increments.
Yeah.
In increments?
2 to 3 hours.
So, huh?
I wish it was 16 hours straight.
About 4 hours, about 4 times a day.
Sometimes. Why does dehydration cause it to bulge?
No, sunken.
Oh, I thought you said,
Yeah,
okay.
yeah. Increased intracranial pressure makes it bulge.
Yes, okay.
So, anyway, sleeps throughout the night for the first 2 months. Clint, is that true? Every class I've taught, they're like, there's a couple of parents here like, no, that's not true, but
She definitely doesn't sleep throughout the night.
so.
Maybe 2 hours or 3 hours at a time.
Yeah. So 2 months, again, starts to able to, it actually, division is actually able out to about 6, I think it's 6 inches, almost to a foot at that point, and actually is able to identify faces. So 4 months is reaching out to people. 6, we actually have some more developmental. Usually developmental movement actually should go from head and work its way down, develop on its way down. Sits upright, 1 sound syllables. In 7 months, for your strangers, again, 9 months pulls to standing position, 10 crawls, 11 walks, knows name. So, and how would you describe this infant?
Pretty normal looking.
No obvious signs of distress.
Yeah.
Color looks good. She's not red. She's not mad.
Or blue.
Upset.
Yeah, not red, not blue. That's always a good one.
Breathing.
Breathing. So, family process. This is kind of one. This can be very interesting to kind of watch family dynamics with their kid. Okay, and like I said, you'll kind of notice look at parent engagement on this. How much the parents are engaged, how much the kid is child is, even if as they get older, how much they're engaged with their parent. Especially you might actually get some children that are about a year or two old, and they're being passed from one person to another. And it's almost like it's indifferent to them. That's a bad sign right there. They should be having some kind of attachment to at least one of the parents, hopefully. So this is, again, we're talking about trust or mistrust. If you guys get familiar with Erikson psychology, Freud, Erikson. Yeah, Erikson came after Freud. So keep warm. Always keep kids warm. Keep warm. Keep warm. Warm instruments. Speak softly. Avoid loud. Please, please don't scream around the children. Oh, and speaking on that note, please know that making your 9-year-old run for 3 hours is not good for her. Huh?
Sad.
That is amazing on levels that I can't even begin with.
I hope that I hope the mom and the grandmother both get punished for that.
Is that a story? Can I hear about that?
Yeah.
They made the 9-year-old girl run for 3 hours straight and she died.
The Punisher. Yeah,
They
it was
punished her because she lied.
this was grandmother and stepmother,
Like around here?
Alabama.
Dehydration.
See that.
Well, it's probably more rhabdo, went into rhabdomyolysis.
Yeah.
You just get so acidotic and just worn down, and
I didn't think about that.
yeah. So that was just, and like I said, you go and talking about child not having those stores, they're just wearing down. I mean, that was just, I just took Alabama back about 100 years, back to the Stone Age. That was just amazing.
Disgusting.
So anyway, distract with toys, pen light, stuff like that. You know, they're going to be kind of relatively curious, examine from head to toe. Basically, you want to kind of let them watch what you're doing. Face is a very personal, protective area with anybody. So that's why yes, they're going to sit there. You know, at least if they can see your hands, just realize, okay, this is not threatening.
Toe to head or head to toe?
Toe to head.
Head for
Yeah,
sure.
they. Like I said, I'm sure if I
You said head to toe and I was
Yeah.
like, it says toe to head.
you know, if you're a little baby and I came up and did this to you, would you be kind of nervous? Yeah. Yeah, exactly.
I'm just like,
Toddlers here, again, looking at vital signs, we're actually kind of starting to dip down a little bit. Respiratory rate's starting to dip down. Pressure's starting to go up. And this is how we can start, again, a nice happy equation to always be familiar with. Get her systolic, 70 plus 2 times the age. Average weight gain 2 kilograms a year up to 8 years. So, and again, we got a little bit more development in our cardiovascular system, which will help it with thermoregulation and hemoglobin levels approaching to that of adults. So, but renal system, again, we're almost up to an adult level at that point. Okay, here we're more susceptible to minor infections. Myelinization increases cognitive development. You guys remember what myelinization is?
Axions.
You remember saltatory conduction? Yeah, makes an impulse jump faster from point A to point B. And find motor skill development. So, again, we're growing. Immature chest starts, immature chest wall muscles. So just remember when you start seeing kids huffing and puffing, think about kids, just remember this, they will compensate, and then they're going to give up. Adults will compensate, and start trickling down. They're going to drop pretty quick. So when you start seeing them struggling, just remember, and the thing is, we don't know when that magic drop is going to be. And all of a sudden it's going to be like drop, and it's going to be like boom, 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 boom. And all of a sudden you notice your heart rate's sitting in like about 50 or something to that extent, and you got to kind of start moving on that. More muscle mass, obviously we're starting to get more bone density at this point. Visual acuity, we're looking about 20-30, and hearing is mature about 3 to 4 years old. Basic language by 3 years old, understanding cause and effect, magical thinking. This is also about the time, I think maybe it's about this, and about in the 5 years old, they kind of have more of an awareness of self. So when they think when things happen, it's because of them. So when, like, for example, when you go to a call with some of these kids, everybody comes piling in because kid got hurt. They're thinking it's their fault. And like I said, that's the big thing you got to kind of keep in mind is, if things are okay, we don't need 20,000 people running in saying, hey, what do we need to do? What do we need to do? Magical thinking at that point, it's hard to differentiate dreams and whatnot, fantasy from reality that hasn't developed. And they say this is where the modeling of different behaviors comes in, and they say this is based off the different sexes, but actually some stuff I've actually read is actually even contradictory, saying it's more of a, some people say it's more of a nature than it is actually an observation sometimes. I mean, there is obviously a bit of an observation, behavior patterns that you do learn from parents, but as far as sex differentiation, I've read things that have kind of gone both ways and say, yes, they're saying yes it does, and there are some that say no, actually, boys will act like boys, girls will act like girls, and kind of thing. Able to play simple games, begins competitiveness. Big thing is gain parents' cooperation, allow child to participate. Again, it's injury and illness is not the child's fault. They may think it is at that point. And again, it's may not be able to locate or describe exactly what's going on. So you kind of have to try to use very simplistic terms and try to help isolate it. The nice thing about them is they're not going to be making anything up. So, again, explain procedures in simple terms. Just warm for the procedure, cover wounds, bleeding, the magic Band-Aids. Understand thing is, especially between now and like this, school age here, they see needles, they freak, because they got held down. The thing about children is they're more sensitive to pain than adults are. And I don't know if they actually have more pain receptors, but they are more sensitive to pain. I don't know if you guys have ever noticed that, or You ever see people that always grab this, like, teenage kid about this big by the ear, and they're like, ow, ow, ow. That's, or a little kid like that. Like I said, they're more sensitive to pain than an adult is. So when, like, when you start pulling out needles and stuff, they're going to kind of freak out. Expect them to freak out. If they don't freak out, I would freak out. Yeah, if a kid holds out the arm,
Yeah, he's gonna try it works.
call it Russ at 5. Having a good.
Can they like create like an issue like with them like flailing their arms around because they don't want the needle or something? Like
That's what IV boards were made for. We end up taping their arm down, and then we plug them.
oh, I don't know if it was like ethical to hold down a child to give them something.
Sometimes you have to. And they will fight and scream. They will fight, and you'll sit there and you'll lock their elbow out, and you're thinking, and they're still just trying to buck you and giving everything they got. And
Like parents hold it,
yeah. So, also be careful, and I've ran this a few times, is be careful of parents who sit there and say, you better be nice or this guy's going to give you a shot.
Yeah.
I've ran into that a few times. Tell them to shut up. Honestly. And I've said, yeah. It's, or at least it's like, no, I'm not going to do that. Don't lie to the, and just tell them, again, this is me, just tell them straight out, don't lie to the child like that. I'm not going to do that. But they'll kind of play those little things to kind of leverage their kids, so. And because the last thing you want them to do is distrust us.
Yeah, right.
So, again, school age, most systems are at adult level at this period. Brain function continues to increase. Actually, full myelinization of the brain for females doesn't finish until about 29, and males it's about 33. Just kind of give you a little FYI there. So for you guys under 33, and they're calling you immature and all that, they're right.
Child heart.
Yeah.
Yeah.
I believe it. Yeah.
Huh? Yeah, it's kind of an interesting concept there. So develop a self-concept. Again, we're comparing themselves to other. And of course, we got beginnings of peer popularity, rejection, and this is where we start getting more neglect and emotional support here issues. Again, does this kid look ill?
Yeah.
Yeah.
Why?
And
Well,
teeth
the eyes
teeth
are
look
red
bad,
and
eyes
his-
look bad.
You got that glazed
Face
look.
Just
swollen.
facial expression just tells them.
Got that that's that glazed look over him.
His hand might be clenching his chest.
What's that called, by the way?
Or is the
What's
fist
this sign
kinda
called?
shake?
What's that sign called?
Yeah, there's a name for it.
Don't touch me or I'll sock you.
No. Actually, no. For cardiac patients, they'll do this. It's called the Levine sign. So if you see somebody doing this, holding their chest, it's called a Levine sign. So school age, you're going to see a big emphasis here on be honest. Believe it or not, they really don't like us lying to patients. I know. Make contact, allow a child to make choices. At this age, they may make up symptoms. You might get the occasional, somebody, school-age child that's, figured out that if I have problems breathing, I can get out of PE or something like that, kind of a deal. And I've actually seen some good school. I remember this one kid. He actually could. He was very convincing on faking an asthma attack. He really had that wheeze well. That it was reverberating really well all the way up here. But as soon as you listen to the back, clears the bell. But he could really just reverberate that wheeze, stridorous wheeze on himself.
Do they tend to lie about symptoms too? Like they don't want to go to the hospital or get an IV, so they may mask things? Or are they pretty?
Depends. You get the thing with children at this point, they're either trying to get something or escape something, and that's kind of one way of looking at it. Or if they're if they're kind of going down playing that kind of situation. If they're sick, they're sick. They're usually going to be pretty apparent about that. And usually you don't have to worry about it. But if they're trying to, if you said something looking kind of odd or suspicious, say, well, is this trying to get something or get away from something? Vital signs, again, like I said, heart rate's going lower, respiratory's going lower, pressure's coming up. Adolescence. And we got you got teenagers, right? Not yet? Okay. So most rapid 2 to 3 year growth spurt begins with enlarged feet and hands, and then follows by arms, legs, and then trunk. Again, girls mostly done by 16, boys by 18. Noticeable external sexual development, pubic hair, axillary hair develops, voice quality changes in males, females have menarche, basically their first menstruation. Endocrine, just kind of get familiar with this. Where does gonadotropin, anybody have any idea where that comes from?
Like the ovaries and the testicles, right?
Gonadotropin? It's anterior pituitary. But anterior pituitary actually goes down and actually activates the ovaries or the testes, and then at that point, you usually get estrogen production. You actually get androgen? Was it androgen and testosterone for males? And usually one of these actually helps development of sexual organ development, and the other one's actually more hormonal. So you they're both hormonal, but one will affect one or the other. It's kind of like just kind of the best way I can kind of explain it. But there's, like I said, there's actually two processes there. So, other changes, body fat can decrease and then later, or you can have a redistribution, depending on what it is. Blood chemistry is equal to an adult. Usually, like I said, they usually say, AHA says now, if the child looks like they're hitting puberty, or we're going to consider they're no longer considered children. Before, the age was always 8 or something like that, or then they said 12 and then they said 10. Now it's just like, well, if it looks like they're hitting puberty, let's just treat them like an adult because their blood chemistry should be relatively the same. I don't know what to think of that picture. It's giving me flashbacks. So, family issues. Huh?
When you were in high
Flashbacks
school?
of
or
yourself?
I had an interesting childhood.
Oh boy.
So a couple things are going on here is obviously strive for autonomy. They want to make their own decisions and do all this other business, but like most teenagers, they haven't had the cognitive ability or the experience to do that. But they're actually on the go there. Obviously, puberty changes, idealistic. Sometimes they have, another term I heard was that they have the personal legend. They believe there's actually something really, truly grandiose for them to fulfill, kind of a thing. And obviously seeks independence and identity, and they do that by mimicking other people. I never understood that, but it's true.
They're total jerks.
Huh?
They're total jerks. I did substituting for a while, like middle school and stuff. These kids always think they know everything.
Middle school's the worst.
Yeah.
Oh, it's freaking horrible.
Those early teenagers, they're just like,
Literally
you know,
just
they think they just
Smart
want to know. They think they know everything.
It's not like back in the day, like go grab a switch and go back.
You want to hear something actually going on? What's even really interesting on children at this age? You guys are familiar with the term Hitler Youth? Towards the end of World War II, they were actually arming Hitler Youth, and the Allied soldiers were actually commenting that those guys would fight more ferociously, because they were, because the Nazi movement was focusing on that whole need for identity and independence and all this, so that they fed on that so hard that these guys would fight to the.
Well, you're invincible, too.
Yeah, they're
there's
yeah,
no fear, then
exactly.
crazy.
Yeah.
And
Now it's actually when I was in
like manipulating kids.
no, it's exactly what it was. Actually, I'm giving another example. When I was doing kung fu, I remember this guy. He was nice kid. He was about 15 years old, but he did not know when to quit. And I remember a couple times. I'd have him locked down, and I'm like, "Do you understand? This is going to hurt even more if you keep squirming." But they keep going, and that's what's kind of scary about them sometimes. So, the other flip side about that, I've kind of noticed this a lot of times with these guys. If you treat them relatively decent, most of the time they're going to be pretty decent with you. If they don't want to be decent, then that ends it. And sometimes I just lay down the rule and say, look, if you're good with me, I'll be good with you. We're just going to leave it at that. But as soon as they broke that rule, then I was just on top of them every second. That I took that away, and you don't give it back. Let somebody else deal with it. So identity issues, increase in self-consciousness, peer pressure, interest in the opposite sex or same sex. It just depends, I guess. Antisocial behavior peaks at 8th, 9th grade. Sometimes it keeps going for the rest of us. I don't know. Wants to be treated like an adult. again, wants to be treated like an adult, but necessarily may not need to be treated. I think it's that hard line. I guess that's why I don't have kids. So body image is a big concern. Obviously the comparing between everybody else, in school and what they see and what they hear. And obviously what's great about, I guess, us as human beings in general, we're very good at noticing our imperfections right away. So common eating disorders, bulimia, anorexia. Then we throw in some self-destructive. You see, this is kind of interesting. This is self-destructive when you're a teenager. So what happens when you're an adult and you're doing this?
It's fun.
This gets legal then. Yeah, medicinal, right?
Coping mechanism.
Yeah.
Maybe what it's saying is that at that age, if you start doing that now, whenever you're 35 and all of a sudden you never smoked it before, and all of a sudden you just start smoking. It's not really, but whenever you're younger, it changes, and then you just want to do that.
Well,
As you get older, it's normal to you.
But yeah, you're become more susceptible to develop habit.
Right.
But I think a lot of it is too. It's just what he was saying about the whole invincibility. I can remember some moments in my youth of I can drink all night and keep going and going. And
Is it true that like most adults that smoke started when they were younger? Like
Yeah.
most adults that just start smoking.
no, most adults will not just start smoking. So actually, I've only knew of one person that relatively started like drugs outside of the whole high school thing, about 20-something, and she spent about a good 17-year stint. But that was like the only one that actually was kind of out relatively. But I guess I've even heard now they say, well, adolescence may be extending to 26 now, 25, 26.
Well, like, what's the early adulthood is like ends at 60 now? Isn't that what it said or something like that?
No, it's a pussy.
Middle adult or middle adult.
Early adulthood ends at 40. Yeah, it's huh?
60, man, you're old. It's like
I don't know. It's changing. A lot of that. Yeah,
Expectancy is
lifespan is changing. People are living longer, and the other thing is, it's just the cultural norm is changing too. We don't hold somebody at 21 the same way as they did probably about 50 years ago. I mean, even if you actually look like early America, colonial America, I mean, when you were 13, you were already getting married. I mean, that was pretty common, and you're already having to work, and you're already doing an apprenticeship and doing your own business at that point. Yeah, 50 was that was considered very old if you made it to 50. Most of the time it was like 40. So the longer that it seems like the longer we progress lifespan, longer those developmental stages start dragging out. How many people are here in the 30s and acting like they're still in their 20s? You're still in your teens, dude, okay? So depression, suicide, very common. It's almost kind of I think it's just, I think we could probably all speculate why or how this comes about. I mean, I think a lot of it's just, again, it's just that growing up and...
Everything at that age is the end of the world, something bad happens.
Yeah, everything is. So trauma leading cause of death, which ones? Primarily males or females?
Male.
Yeah. Why?
Stunt.
Because that's it. We're dumb. Huh? Yeah. Hey, yeah. Yeah, hey, watch this. This will be really cool.
somebody recording this?
And then on YouTube.
Huh?
Right?
And then it's on YouTube, yes.
Yeah,
Recording
that's-
this?
That's what.
Have you ever seen the kid that throws the fits? Oh.
Yeah, I've seen that. Where
The-
it
That
freaks
plays
out.
the WoW.
The what?
There's tons of videos.
Oh, there was one that was just he'd always like antagonize his brother,
Yeah.
and he'd start smashing stuff, and you'd hear just giggling and
Oh,
giggling.
yeah.
I gotta see if I can drag those up, but that was just one of those just like
It's like
boom.
hidden cameras, and that kid
Yeah.
does
Yeah.
weird stuff when he flips out. He like gets naked or something.
Yeah, yeah.
Oh, yeah, like, he told him, like,
He's flipping out because his mom canceled some gaming.
Warcraft.
And he goes in.
Yeah,
Right.
Yeah.
the World of Warcraft. WoW.
Yeah, there's like 4 or 5 of them, the same kid.
Yeah, but
Dude, he goes
he keeps.
ballistic.
Yeah, it's the little brother antagonizing the older brother.
Yeah, there's like one of them sitting in the tree or something like
Yeah.
that.
But the kid has like autism or something like that too.
Is that what it is? I
Yeah,
don't
or
know.
Asperger's or something like that.
Awesome. One of my buddies, he got on top of like the stairs of the football stadium, and it's just there's metal bleachers, and he just basically just threw himself down the metal bleachers. He was just rolling down the bleachers just so.
Yeah, just because you can, right?
I was just like, yeah, I'm not going to do that, but go ahead, more power to you.
Yeah, yeah. So, yeah, it's a very adolescence really is an interesting age when you sit and look back on it. Thank God it's over.
How am I alive?
Well, for you, it's how are you still alive, Ethan? How old are you? What? 19, 20?
21.
You really?
21 in October.
Oh, so you're 20.
Yeah.
Okay.
More like 15 apart.
Like a month after I got my license, I totaled my first car. I completely totaled my first car.
You're
Brand
not
new
the only
diesel
one.
car.
Huh?
I said he's not the only one.
That's 20 or totalist car?
Total.
Yeah.
A month after getting my license, yeah.
Craig crashed it. I just kind of.
No, I somehow for some odd reason remember being 17 and I got this 76 Mustang. Wrong idea.
So you only get home in 4 minutes.
Well, I live in Colorado, so everybody's like, we're going off-roading. I can do that too. And I look back and I'm like, God, that was such a nice car. Why the hell would somebody give that? So, again, like talk about feelings of incivility. It won't happen to me. I know I can handle it. I can deal with it. I remember hearing that one. I'm healthy. I know what I'm doing. Blah. So again, generally, like I said, treat as adult. I'll treat them as adult to begin with. And sometimes you'll notice, especially when there's other family or adult figures around, sometimes it's best to remove them, and you'll probably get a little bit more information. A lot of times we always kind of gear this towards, we're trying to figure out, if some 16-year-old girl might be pregnant or something, but it actually goes for guys as too. Sometimes that whole dynamic and stimuli, remove them out of the picture and say, hey, what's going on, kind of a thing.
So, like, if the parents ask you something, like, say you get to the hospital and they're, like, standing there, and it's like, well, what's going on with my kids? Like, they're not, I mean, to me, they still have...
They can know.
They can...
They have
They're still minor then.
The thing is that they can't, that puts a big, if it's anything that, for example, like a child, a minor can go in and get medical treatment without consent for any kind of substance abuse or treatment for any kind of sexually transmitted disease.
Really?
Yeah.
What about
And you
pregnancy?
can't
Not the whole
tell-
pregnancy thing. You separate them so you can get the information you need to
That's
know.
in that.
But if the parents ask you, do you have to tell them?
If she says she thinks she's pregnant and possibility of pregnant, she becomes an adult at that point.
So you don't let those other parents.
Yeah, so if they come out and they're screaming at you, you'd be like...
So what exactly did you say? It's just like,
They'll find out eventually if she is pregnant. I mean,
Yeah, that's one of those things. It's like, hey, let's hold this off to the hospital. And I mean, some people, most of the time, they won't. The ones that you see adults really get into, I've seen really get interactive, and it's not because of the pregnancy. It's usually not that. It's usually because there's just a very dysfunctional dynamic, and there's a lot of control issues going back and forth. Kind of.
Those were meat like, so how do you separate?
A lot of times, the best thing to do is if they're going to ride, you sit up front. Don't let them sit them back, and that's one way because once you're in that box, you're fine. And you can kind of start isolating, stuff like that. Or you sit there and say, hey, we're going to go once you follow, da-da-da-da-da. But like I said, some of these people can get a little too over-involved, and it's like you have to, and you can just sit there and say, hey, look, these are our rules. We're not supposed to have people back here. If you want, you can have somebody up front, or maybe best to meet us there. That way you have somebody to get home and get them away, But if they're at that point, like I said, like I was telling you about that 18-year-old and this lady sitting there, trying to get in everybody's business that she's her mother, it's kind of like, no, you don't even count anymore. Go stand outside. That's it. That's just it. That's it at that point.
so they don't have to be confirmed pregnant in order for that to apply. If it's just they could possibly be pregnant.
If they think they're pregnant, it's kind of like that, the DNR and pregnancy thing.
Mhm.
You don't want to find out you're wrong.
Right.
Now, you find out you're wrong and they're pregnant and you violated their rights. Bad situation. So, err on the side of caution. And like I said, some of that personal information they're not going to want to say around parents. And like I said, the other ones I found that can actually be pretty nosy and obnoxious, believe it or not, are people at schools. Teachers and principals can be very, and that's one thing you can shut them out. As soon as they call you, that's your patient. They're out of the game. School nurses, on the other hand, they don't care. They're more than happy to give them to you. Okay. So anyway, get history from the patient, respect independence. You know, like I said, keep in mind, we want to leave an impression that they can trust us in the future. I mean, obviously, depending on whatever issues they may have some anti-authority issues on top of it. We don't want to be the bad guys. So if they sit there and say, yeah, I'm doing drugs, okay. What are you doing? Okay.
No, we're not there to judge.
Yeah. So. Vital signs, again, you can see we're kind of getting more into an adult stage here and within normal ranges. Peak physical condition, they say, is between 19 and 26. I think that's going to be changing. And I think a lot of it has to do with health and nutrition. I mean, I think probably about 30 years ago, seeing, you know, athletes in their 30s was rare. Now we're kind of seeing it as more common. So developing lifelong habits and routines. So yeah, if they're smoking or, you know, whatever recreational actions they may have, they may carry it on to adult life. So ideally, their body systems are at optimal performance. And again, this is this again at early adulthood. I mean, again, we're kind of looking at they say that kind of actually starts dipping around 30. But I don't know how much that's really true. I think a lot of it is just how well you take care of yourself. I mean, this is actually going to be a very good precursor to what happens later on down the road. But it's hard to say. Early adulthood, high levels of stress in this group. What do you guys think on this?
College, starting new jobs, starting families.
It's welcome to the real world. Nobody's telling, you know, the ironic, it's always kind of ironic when you think about it. We sit there and we run these kids' lives. I mean, we really do all the way up till about 18 years old. And then say, okay, now go figure it out.
It's like that seeking independence, and all of a sudden this hits, and then it's...
Yeah, once they get it, then all of a sudden...
And now you're freaking out. 'cause you got screwed.
Then they're, you know, rolling around 6th Street and, you know, doing stuff like that. And I always just found that just kind of ironic, you know. No, we're going to control you. We're going to control you. No, make it. Okay, fine. Get out of here. Make your own decisions. Bye. So, childbirth is generally common at this age. I think that's going to be changing probably in the next decade or so because most people are marrying later and having families later in life. Fewer psychological problems related to health and development. So... Again, vital signs similar, middle adulthood, vital signs similar to early, varying degrees of body system degradation, little things here or there. This is when you start seeing cancer kind of popping up. Different types of cancer will start popping up in your 30s, or you become more prone to it. Obviously, you get older, you get more prone to different types of cancers. But weight control gets a little bit more difficult. You don't have that, you know, stellar, like I said, your body's not growing anymore. The metabolism says, hey, I don't need this. And that's really kind of the big halt right there. So, you know, and trust, that's one of the things I remember running into after 30. I was kind of like, what happened? I remember the day, you know, literally eating 2 Big Macs, 2 things of chicken McNuggets and fries, and I was fine. That day doesn't happen anymore. Cardiovascular system, cholesterol levels increase. Sometimes people actually do have a genetic predisposition to that. But again, what are we eating? Look at, you know, this is kind of, you know, the post-McDonald's generation, where people are just eating that stuff all the time. Decreased cardiac output, again, that depends on how healthy you are. Are you taking care of yourself? Are you, you know, exercising, all that? And again, you know, risk for, you know, again, we're giving more of a risk for, you know, heart attack at this age. So menopause, we're looking at late 40s, 50s. The other thing is they always run into is what they call the social clock. You know, they come to the realization of, wait a minute, I'm not going to last forever. And you feel it. They're feeling it. It's like, hey, I'm not going to last forever. I don't feel the same way. They start to get the pressure of, you know, start accomplishing XYZ goals. So.
Is that like the midlife crisis?
Yeah. I think that's part of it. You know, it's just you realize you're not young and time is going to ticking. So let's take a break here.
Have you hit your time clock yet? You hit your time clock yet? Did an injury in the respiratory for this guy. He had like MR. I felt so bad. He's like started crying because crap. It sounded really bad. I assisted.
So other things with middle age, financial burdens. You got elderly parents and young adult children. So you're kind of like right in the middle there. So I mean, be paying for college, and then you got to worry about what's going to happen to mom and dad at that point. So vital signs all depends on late adulthood. Vital signs on health status. Genetics plays a big, big role. You know, depending on what your genetics are, because you see people that were very well off, and some people that weren't, and then like severe. I mean, I guess the kind of the best example. Think about that guy that's like 80 years old, smoking filterless cigarettes. You guys ever ran into that person? That's genetics right there. No, I'm not even talking to trach. I'm talking he's smoking a pack a day for the last 40 some odd years, and he's still getting up, walking around. He's fine. So, like I said, part of it's going to be genetics. Part of it's going to be how well you take care of yourself, and that's going to kind of assess what your status is going to be. The thing is that really, really changes is understand, like I said, a lot of your cells are replicating at this point, and sometimes the cells aren't replicating as much and it's getting replaced with fibrotic tissue. That's it's really one of the big reasons why you see such changes, like the increased vascular resistance. We don't have that elasticity anymore. Decreased baroreceptor sensitivity. Those cells aren't reproducing anymore or as well anymore. And you're just going to see decreases in everything. And say that, in fact, they say was that by the time you're 80, you have, was it 40% of the lung volume you did at 20, just because of age. So, and again, like I said, you can see chest walls weakens, diffusion of alveoli decreases. Again, that's more fibrotic tissue replacing it. Less cough effective, less muscle tissue, same thing. Fibrotic tissue is replacing a lot of those muscle cells, myocytes. Decrease in glucose metabolism, decreased insulin production, cortisol diminished. 50% of your nephrons are lost. I mean, everything's it's going down. Yeah, it really is. So, decreased. The thing I got to keep in mind here is perceptions of pain are going to be different. Okay? They may feel odd, and they may be having that heart attack kind of a thing. They may not. It may not be as profound. That's the thing you got to kind of worry about. I mean, loss of hearing and is one thing. Decreased reaction to smell and stuff. But I mean, these are the guys that they're going to be sitting at home, with their heaters blasted up. It's wintertime, and they're going to get the CO poisoning because they're not really aware. They don't have that perception like we do. It's like, wait a minute, I'm feeling sick, I'm nauseous. It's just not. They don't, like I said, they just don't have that receptors all there. It's just, like I said, it's just it's called entropy. It's just entropy. So, and generally, most cultures, wisdom is attributed to age. I don't know how our culture feels about it some days. So, most common, obviously, we see them living in communities. You like 55-plus apartment communities, some nursing homes, stuff like that. The things that they kind of start having problems with is self-worth. I mean, they kind of have a big loss of confidence because, some of them may not be in the workforce anymore. They're not doing a lot of the hobbies and skills that they used to. So they're kind of like, well, what good am I, kind of a thing. Declining health, obviously, that's going to be kind of self-explanatory. Financial burdens, if they're retirement, did they have anything for retirement? Or if they had retired, are they just being, bombarded with, medical bills? The death and dying of companions of friends. I remember talking to Dr. Benold one time, and I was asking him about his elderly patients. They said one of the things he ran into the most was a lot of them were very ready to die as they got older because the world that they remember, that they kind of grew up in and that they were more active in early and middle adulthood isn't there. And all their family and friends are gone. Everybody's gone at that point. It's kind of like, so this whole other world exists and they're very just removed from it.
You know what, like the suicide rate in the elderly is higher than it is in
Yeah, I think it's, I don't think it's higher, they're more successful.
Yeah.
It's higher in adolescence, but they'll get it done.
They're smarter.
Yeah, that's a wisdom thing. Pop, Mm-hmm. It's like, we're going to get this done right. But yeah, it's just, like I said, I guess, like I said, just try to imagine, like, the way we, envision the world, the way we experience the world now, by the time we're 89, it's not going to be there. it's going to be a whole different world. And like I said, more years go by, we get more and more removed from it because we're not actively involved in it like we are now. So, okay.
Your life lesson for you guys.
And they think that's because of a tryptophan overdose or something like that.